there, I'm Mark Kennedy, and you join us today at Brighton's newest hospital, where we're talking to the Managing Director, Dr. Peacock.
Call me Drew.
So, tell us what you do, Drew.
Well, that famous Shakespeare quote, if laughter be the food of love, then nom on.
I'm not sure that's...
Well, we took that philosophy and we made it the foundations of our new multi-million-pound hospital here in Brighton, the Hospilol.
Very interesting approach, that's for sure. But is there any evidence that your methods are actually working?
Well, you can see for yourself. Let's go see some patients. Ah, yes, here we have Mrs. James. She came in about a week ago with a hematuria and dysuria, which is a pain in the pisser and blood in the whiz to a plebs like you. Anyway, we did a few investigations and found she had a Clarence Martin up her vagina.
I beg your pardon?
Here at Hospilol, we try not to scare the patients. We're trying to dispel some of the stigma attached to some of the more serious medical conditions. So instead we'd use anagrams. It encourages the patients to accept their diagnosis.
So a Clarence Martin would be...
Yes, a terminal cancer, not a young Englishman. Unlucky Mrs. James. Anyway, we also like to tell the patients here they have arms.
But that's ridiculous, they all have arms.
I know, it's appalling, isn't it? We have found this approach not only helps the patients to relax, it completely bamboozles them. If you tell a patient they have heart failure, they'll go home, they'll Wikipedia it, they'll question your every move, they'll make your life a living hell. But if you tell a pregnant patient they have real ant twigs and their husband doesn't, it doesn't bring up the same paternity issues as you might do if you tell them they have genital warts. So, how are we doing today, Mrs. James? Mrs. James?
Oh, don't worry, she'll be fine in a couple of hours. It's just one of the side effects of a drug that she's on.
Which drug is she on?
Oh, tequila.
Tequila?
Yes, at the moment she's off her tits.
Ah, yes. Here on the Charlie Sheen ward, we like to help our patients relax as much as possible. It helps them see the funnier side of their conditions as well, yes. Ah, look, here are two of our brightest third-year medical students. How are you doing, Francis and Hilary?
Sorry to bother you, Dr. Peacock, but could you please sign?
Oh, your LOL books. Oh, yes, of course. Which bit am I signing here?
Just the clinical skills section at the back.
Ah, and who did you see?
Mr. Michaels. I made him laugh so hard he pissed himself.
And you?
I made a patient laugh so hard that they died.
Well, will I be seeing you in my clinic this afternoon then?
Well, about that, we've got teaching this afternoon.
Bollocks! What have you really got?
Well, I was gonna have a nice nap, and Hilary is
Getting late.
Oh, excellent. Well, off you trot, you two scallywags. Students these days.
So we've heard about how Hospilol treats patients with chronic conditions. What about those in a more acute setting?
Funny you should ask, Mark. We're currently in the middle of implementing some new resuscitation guidelines. The current gold standard is 30 seconds of tickling, followed by 2 breaths of laughing gas. However, we've already had to change those guidelines once, as the patient is being revived. The laughter's so infectious, the whole team starts laughing so hard, they piss themselves.
again.
Also, on A&E admission, we're trying to make sure that all patients are put on beta blockers, so atenolol, bisoprolol, that kind of thing.
Very interesting. Well, thank you, Dr. Peacock, for giving our viewers this insight into the workings of Hospilol.
Ah, not at all, my pleasure.
So, I've been Mark Kennedy. Thank you for joining us.
You bastard!